Welcome to CCK Live. In this video, we're discussing common questions that you may have about your next C&P exam. The first question is, why are C&P exams so important? C&P exams are used to determine whether a disability is related to service and/or establish the severity of a veteran's disability. Your C&P examiner will not provide any treatment during the exam. The purpose of the exam is just to gather evidence about your condition. While it is a common misconception that C&P examiners make the final determination whether a veteran's claim is granted or not, an examiner's findings are often integral to the final ruling. This means that examiners' opinions and reports are heavily considered when a decision is made. Examiners have the power to agree with the veteran's description of their symptoms and their symptomology, as well as disagree with the veteran's symptoms or their description of their symptoms, which can often be devastating to a veteran's claim.
So another common question we get is, what does a C&P exam actually consist of? So when requesting an exam, VA will send a notice either informing you that exam has been scheduled or indicating that you will need to schedule one on your own behalf. Before the examiner will review your entire claims file, which consists of previously submitted evidence and medical treatment records about your condition. During the examiner may physically examine you or ask questions about your service, disability, and/or the connection between the two. It can be helpful for veterans to go into exams prepared to talk about their symptoms and how they impact their day-to-day life. VA examiners might also complete a disability benefits questionnaire or a DBQ. Each DBQ is drafted to correspond with a specific condition and is formatted for the examiners to check a box next to the descriptions that most accurately depict the disability in question. It's also important to note that C&P exams can last anywhere from 10 minutes to 1 hour. If the exam is very brief, you may not have been able to present the examiner with a complete picture of your condition.
Before we get further into what to do at an exam, it's often important to remember what not to do at an exam. So first and foremost, the most important thing is don't skip the exam. You have to attend, and if you don't attend, your claim is likely to be denied. If for some reason you can't attend the exam, make sure to contact the provider as soon as possible to reschedule, and then once it's rescheduled, make sure to attend the exam at the newly agreed upon time. Another important rule is remember not to ramble, be unclear, or use unclear language. It's important to remember that you shouldn't use legal terminology when you're attending your VA exam because doctors aren't deciding your case, and they're not lawyers. They're not usually going to be familiar with VA regulations, case law, or any kind of legal language you might want to use. Be clear and concise about why you believe your disabilities are related to service and about how they apply to your life and impact your life on a daily basis. And give examples of your daily limitations to help get your point across. Another thing that you want to keep in mind is that you need to remember what is actually at issue during the examination. Know what you're being evaluated for, be it service connection versus an increased rating, because whether or not you're going for service connection or an increased rating is going to affect the questions that you're asked, and it's going to affect how you should be answering those questions. It can also be helpful to know if it is an increased rating exam, it can also be helpful to know what the rating criteria for your condition are in advance. So you might want to look those up so you can get a sense of what the examiner is looking for beforehand. Another thing to keep in mind is you do not want to quote unquote malinger or exaggerate. VA examiners are trained to look for exaggeration, so don't do that. Just be honest about your condition, how it affects you, and avoid that malingering label as much as you can. Just, again, be open and honest about how your condition affects you on a daily basis. However, on the other side of the coin, you don't want to downplay your symptoms either. Don't use general terminology like I'm good, I'm doing okay today. Be honest and specific about your condition because how you portray your symptoms is going to greatly impact your eventual rating down the road. So don't unnecessarily downplay your symptoms because it could actually result in a lower rating if you're not telling VA exactly how you feel and how your conditions affect you from day to day.
The next question you might have is, can I bring evidence to my C&P exam? Veterans do not need to bring evidence to their exams. If they do have new evidence, like new records that are not VA medical records, it's important that you submit them before your appointment. This will allow them to enter into your claims file, which, as we mentioned earlier, the examiner should be reviewing prior to the time of the examination. If you do bring new records to your examiner may read them, but they also may not, and they can't submit the records for you. So it is something that is ultimately your responsibility to make sure it gets into the record for VA to consider. However, you can bring notes to help you remember things that you want to say during the exam. It can be helpful to just have some talking points so you know how to answer questions. Again, looking up things like the VA rating criteria, just so you're aware of what the examiner might ask, as well as symptoms that you might be experiencing on a regular basis, just to kind of help guide you throughout the exam.
So another question that's commonly asked is, can you bring a family member to your exam? And the answer is yes. You may bring a spouse or a family member to your exam. In a lot of cases, this can actually be very beneficial. Oftentimes, this spouse or family member can serve as a witness to the symptoms that impact your day-to-day life. However, when you do bring a family member or a spouse, it is important that you have a discussion with this person beforehand, just to make sure that they're on the same page and can get the information to the examiner adequately.
Getting back to the topic of the examination itself, veterans often wonder whether or not separate conditions require separate examinations. And that's often going to depend on whether or not the conditions you're claiming are related. For example, a veteran who has filed a claim for a knee condition and a psychological condition are necessarily going to receive two separate exams for those conditions because there are different doctors with different specialties. And in theory, they're going to get those doctors to evaluate your condition based off of different criteria. And you'd want a specialist, hopefully. Sometimes they don't always assign them to the correct field, but ideally you're going to want different examiners examining different conditions like a knee condition versus a mental health disability. These are different medical areas. They involve different medical questions. And you want to make sure that the person asking you the questions is, competent to do so.
The next question you might have is whether your examiner will diagnose you during your examination. Examiners will provide a diagnosis if that's something that they are required to do for the purpose of VA making a decision on the claim. This will also help to inform them for whether they can provide a nexus opinion, meaning that whether or not they can relate it to service. They can also say that there's no diagnosis for a condition if they don't believe that there is one, or they can refute private treatment notes so long as they're providing an adequate rationale or explanation as to why they disagree with those records. VA C&P examiners will also make a determination stating, again, whether the condition is at least as likely as not related to service or not at least as likely as not related to service. And if the examiner says that the condition is at least as likely as not caused by service, they're saying that there's at least a 50% chance that the current disability is due to service or an in-service injury or an event, which is really all VA requires to grant service connection for a condition. It's just a 50-50 burden of proof. So that would ultimately be a favorable decision.
Another question that often comes up when dealing with VA exams is whether or not you can actually get a VA disability rating without attending an exam. And to be honest, in very, very rare circumstances, you can, but it's going to depend on the type of disability we're talking about. There are certain conditions that are automatically rated a certain way. So as long as you have private treatment records confirming a diagnosis, VA may be able to rate the condition without getting their own exam. One particular example might be a veteran with active cancer who submits evidence of that active cancer diagnosis from a private provider. In that situation, VA is going to assign that 100% rating without necessarily getting an exam, but they will, however, schedule you for a future review examination to determine whether or not the cancer is still active, which might be 6 months down the road or a year down the road. But that's, by and large, the only circumstance where VA is not going to schedule an exam initially. But they're almost always going to request a review exam to make sure that the disability is as severe as it was, up until the point that they determine that the disability is permanent and potentially totally disabling. And in those situations, they won't re-examine you. However, if VA does request a new examination, you have to attend. Skipping an exam might result in them assigning a 0% rating if service connection is being granted, or they might just deny your increased rating completely if they don't have the information that they need to determine the severity of your disability.
So after a VA exam, a lot of veterans will ask, how do I know if my exam went well? And the best and often only way to do this is to read the actual exam report. However, VA doesn't just issue a copy of the report unless the veteran specifically requests it. So it's definitely important if you don't think your exam went well to request a copy of this exam and go through it. To do this, veterans can send a letter to the VA requesting a copy of their exam report. Once you receive the copy of the exam report, you should review it to ensure that the exam report adequately represents the details that you did report. If not, or if the report is unfavorable, you most likely want to refute the findings.
And that leads into the last question that we're going to talk about, which is what should I do if I have a bad exam? Challenging an exam can be really difficult, and it does often take the assistance of a skilled, accredited representative to help refute those negative findings. But there are several ways that veterans can also refute negative findings on exams. One of those ways is to submit private treatment notes, which may help to provide a little bit more detail or explanation as to symptoms or diagnoses, or help refute an examiner's findings. You can also submit a private medical opinion, maybe from your treating doctor, which again can take a look at the VA's opinion and refute those findings, whatever they may be. You can also refute the examiner's credentials. We talked about earlier, you want to make sure that the examiner that's providing you with the exam is actually qualified to look at and assess the condition that you're being examined for. So you can refute those examiner's credentials if they don't really align with what you're being examined for. For more tips on C&P exams, please be sure to check out our blog and other videos. Be sure to like this video and subscribe to our channel to stay updated. Thank you for watching.